Good afternoon. I'm Dr. Doug Evans, Chair of the Department of Surgery at the Medical College of Wisconsin, and we're continuing our series of interviews with a lot of our patients to serve as inspiration and resilience and strength for those of you who are going through medical diagnoses right now. And so I'm lucky enough today to be with Mr. Dennis Whitehead, who's a pancreatic cancer survivor. And Mr. Whitehead, thank you so much. I still have trouble calling my patients by their first name, but I'll struggle through it. I'll get there. Dennis, Mr. Whitehead, thank you so much for coming to the Medical College of Wisconsin this afternoon just to make this video. And maybe we can start with what was going on in your life when all of a sudden you were diagnosed with pancreas cancer.
Very good. My story begins about 4.5 years ago, and at the encouragement of my primary care physician and my wife, I was trying to shed some weight, get some weight off, and so I began to count carbs and make diet changes, and it started to come off very quickly, very rapidly, and I thought, gosh, if it was this easy, I'd have tried this carb counting a long, long time ago. But I started to experience also some lower GI function differences and what have you, and during this process, my primary care physician discovered through routine blood tests for the annual physical exam that I had some elevated blood glucose levels, which I'd never had before. None of my family had any significant problems in that regard. So I began monitoring my blood glucose and watching my carb intake and that sort of thing. And then while vacationing with friends in Florida in February of 2019, I began to become jaundiced. My eyes were turning yellow,
Wow.
my skin was turning yellow, so I knew something was going on that wasn't right. And like too many of your patients probably, I used Google to get on the internet and do my self-diagnosis. And
Well, I'll tell you, the one thing you brought up about your weight going down and the blood sugar going up, that's probably the most sensitive indicator that there's something wrong with the pancreas. Because usually in older adults, if the blood sugar goes up, it's usually because the weight is going up. So the weight, because the pancreas has, in general, a limited ability to make insulin. But if the weight goes down and the blood sugar goes up, that indicates that there's also insulin resistance, which is a hallmark of pancreatic cancer. So we notice this so frequently in our patients that the jaundice follows a period of elevated blood sugar.
And that was my case exactly. So I knew by a little self-research that could be something as treatable as hepatitis or something as daunting as pancreatic cancer. And so as soon as I got back home from that Florida trip, I got in to see my primary care physician, and long story short, the result of those tests and scans confirmed that I did in fact have pancreatic cancer.
Yeah, and then how was that treated?
Started off with a series of well, first of all, a gastroenterologist had to put some stents in to relieve that blockage in the bile ducts, and I started to turn white again. And then I started a course of chemo infusions.
And where was the chemo given? Was that given here or at home? Or
that was we were living in Iowa at the time, and that was at the University of Iowa hospitals and clinics in Iowa City. And after that series of chemotherapy, I also went through a series of radiation therapy treatments to isolate the tumor and prepare for my life-changing surgery.
And how did you end up coming here?
That's a story and credit I owe to my family and some family acquaintances. Members of my immediate family started looking at who are the really top-notch surgeons in the pancreatic area, and your name came to the top of that list, and they started to encourage me to try and get in touch with you. And then a mutual acquaintance, a former doctor here at Fredericton, Milwaukee Medical College of Wisconsin, also strongly encouraged us to get in touch with you. So we did that, and in fact, as soon as I met you and your staff at the Hope Clinic, I knew I was in the right place.
Yeah, well, that's great, and we're thrilled we had the opportunity to help. And so after you got the chemotherapy, the radiation, and we work, for those of you who aren't familiar with our program here, we work with so many institutions across the country. It's most common that our patients receive their chemotherapy and to some degree their radiation therapy at institutions other than ours, and then oftentimes come here for the surgery. What was the surgical experience like? I mean, obviously in your case it was a big operation.
Well, you told me it could be as complex and as timely as 12 or 13 hours if it was a complicated surgery, but I was one of probably the more fortunate ones because I think you told me I was only in this operating room about 6 or 6.5 hours, so
That's
I
good.
came through that surgery in flying colors.
And how long were you in the hospital?
Oh gosh, I'm not sure I remember right. Probably, what, 3 or 4 days before I was discharged to stay locally for a while longer.
Yeah, probably a bit longer than
Yeah.
that. I think you might have had the record if it was 3 or 4 days. We have a few people at 5, and it's good that it was that memorable. But a few people at 5, most people at 7, occasionally some people at 6, and it really is just the operation changes kind of what I described, the plumbing and the electrical work. So it just takes a while to get used to that. And in order for people to go home, they have to be drinking enough to stay hydrated, eating a little bit just so they have adequate calories because that will improve. And most importantly, the ability to take care of themselves, to take a shower, to get dressed, to walk, all those things. And, it takes a while. And because our nurses are so amazing, one of the things we find is that most people don't realize how much the nurses are doing for them. And that's even when they say, oh, I'm doing everything, but it's just fascinating how the nurses are just so smart, attentive, and everything else. One of the things I wanted to focus on, and the reason why I wanted to do this video with you, is after the surgery, what we take out of the body goes to pathology. And in the United States, it's actually a requirement for every hospital that every piece of tissue that's taken out, with the exception of heart valves, because heart valves virtually never have tumors on them. Heart valves can simply be thrown away. If a bad heart valve is changed out for a new one, the surgeon can throw it away. Everything else has to go to pathology and make sure that there is or is not cancer there. With pancreas cancer, I think the people who are interested in this video will know that one of the things that we check is the margins, whether we got all the tumor out, the primary tumor. And then here we're blessed to have 2 women who are physician's assistants who go through the surgical specimen that my partners and I remove, and they manually go through there and take out every lymph node that they can find. So if I did this operation at a different hospital, for example, they might only find half the lymph nodes that are found here, just because these 2 phenomenal PAs have been with us for the last 15 years and do such a great job. Sometimes we have lymph nodes that are still positive despite the chemo and radiation. We would like them to all be negative. In your case, we knew going into your treatment that there were a number of positive lymph nodes from the CT scan. Gave you really great treatment in Iowa, was hoping that the cancer in those lymph nodes would all be removed. In your case, it wasn't. And I think it's inspirational for people watching this video to know that despite multiple positive lymph nodes after your surgery, here we are. I think your last checkup was completely normal, right? Complete bill.
Everything was clear.
Everything was clear, I think. But after surgery, because of those positive lymph nodes, you did receive some more chemotherapy.
Absolutely.
Is that correct?
Yes, I did. And that also was done in Iowa, where we're living. And it was a combination of in-clinic infusion treatments, and then for several weeks I would take the at-home chemotherapy home with me with the metered pump and wearing it 24/7 for a couple of days after each infusion treatment. And the guy got pretty good at handling that infusion pump.
Yeah, and how did, you obviously are just an incredibly tough person. You got through everything, but the chemotherapy before surgery versus the chemotherapy after surgery, how would you contrast that?
I would have to say the post-surgical chemotherapy probably was rougher than the pre-surgical chemotherapy, but certainly I recall you discussing the options that were available to me following my surgery, and there were different levels of chemotherapy treatments that I could have chosen, and was about to pick one that people told me was probably held a lesser chance of negative side effects or whatever after, but thank you for encouraging me to consider the more aggressive course of treatment, because the outcome has certainly been worth what that chemotherapy was all about.
And I think people should realize that the doctors would never want the treatment to be worse than the disease. So we would never apply a treatment that we didn't think a patient could handle. And to show everyone that's watching this video the progress that we've made. I mean, your surgery was in, what was it, September of 19?
2019.
And since then, probably beginning around the time of your surgery or a little bit after, I think probably a little bit after, we're now routinely looking at the genetic mutations in every patient's tumor. And in addition to chemotherapy, there sometimes are oral medications that can be targeted at specific genetic mutations found in the tumor that may not be found in someone's native DNA, that we also can give after surgery. So the field is moving right now so fast, and that's why I think anyone watching this video, it's always appropriate to consider another opinion, be it either a paper opinion at an institution like ours or somewhere else, or even seek a second opinion, because the field is just moving so fast right now. And it doesn't mean that you have to move your location. So in your case, all of your treatment was in Iowa except for the operation. But you can get more doctors on your individual team.
When you talk about how fast the treatment is changing, I remember right at the very start of my journey when I was jaundiced, and the gastroenterologist in Iowa put the stents in those bile ducts. He said, "Dennis, the changes is happening so quickly that the paradigm is changing. So today's prognosis may not be appropriate at all 6 months down the road." So it's great to hear those kind of things are happening.
Oh, absolutely. What do you think was the key to you getting through all the treatment? Because your treatment was probably a little bit longer than most people with operable pancreas cancer. How did you stay positive emotionally, and what was your support team like?
I'd have to start off by saying, the continuing support of a loving and engaged and supportive family. Certainly confidence in and the Hope Clinic team, your team, Dr. Evans. Also, we were surrounded by a large number of good friends who were very supportive and were helping us out all the time. And in our own personal case, our faith means a great deal.
Yeah, so important. Last question, what are you doing now to pass the time? What occupies most of your days right now?
Most of what I'm doing now is whatever my wife puts on my to-do list for the day, but we do enjoy our grandchildren. That's the reason we moved from Iowa to Wisconsin. Yeah. Our only 2 grandchildren are here, and we see lots of tennis matches, basketball games, baseball games, and concerts.
Oh, that's so much fun. Well, Dennis Whitehead, thank you so much for sharing your story with us today.
Thank you, Dr. Evans, for being a great surgeon, and thanks to all of your team, Gabby,
Natalie, and the
Natalie
whole
and
crew.
Everybody, you bet.
You got it. Thanks.